What is going on, gangers? Brother Nambi back at your service, and I'm here to dive into a continuing series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. For part 24 of this series, we are going to dive into a fictional character that people may or may not know, and his name is Flapjack from the Marvelous Misadventures of Flapjack. I decided to use tooth decay to describe Flapjack's condition. Let's first dive into what tooth decay actually is. So tooth decay is basically the process of a tooth weakening in its surface, which leads to caries, which is a lesion, which could also mean a bruise. That would then result in what most people call a cavity, or basically a hole. I ain't gonna lie to y'all, there are many risk factors to developing cavities. So let's go one by one on them. One could be poor oral hygiene, not brushing or flossing your teeth daily. High sugar diet, that's gonna make more bacteria get in your mouth. Having a dry mouth without saliva, pause. Genetics, that's also one. And having specific medical conditions, meaning diabetes, acid reflux, or eating disorders like anorexia or bulimia. Not only that, for my weed smokers or regular smokers, or even people who just drink alcohol non-stop, you're at risk for damn cavities, just know that. And lastly, let's make a note of this. When you have low socioeconomic status, it's less likely that you're going to get adequate dental care. And that means that you're high at risk for these dental caries or cavities. Now on to signs and symptoms. In mild cases, you would basically see tooth sensitivity to sweets, anything that's hot or cold, and you would have mild pain when biting or chewing. You may also see black or brown holes on your tooth. For more serious cases, it would be toothache at night after eating, fear of eating certain foods, like things that are hard to chew, and then also swelling or abscess, basically infection with pus, and severe tooth pain or jaw pain. Now, how does this correlate to Flapjack? Flapjack likely has cavities because he eats too many sweets, he doesn't brush his teeth, and so we're assuming that he doesn't have good oral hygiene. He lives in a dirty seaside town, which basically means he probably doesn't have access to good, proper dental care. So he's at more risk for having cavities. And that man Flapjack's diet only consists of sugar, and it lacks calcium and vitamin D, which strengthens your teeth. Now, how is someone diagnosed for cavities? Basically, you would determine based on their symptoms, and a dentist will look for areas of discoloration, tenderness, and inflammation. And for treatment of cavities, if the decay of the tooth is at the enamel, then a dental filling is recommended. This is basically filling in the hole that has surfaced in the tooth. And if the decay has traveled to the pulp and is infected, a root canal has to be done. And that, my friends, is not a good sign. I want to also note this, guys. All this can be prevented, man. Using antibacterial mouthwash, rinse daily. Brushing your damn teeth twice a day. That thing is not hard to do, guys. Get up from your bed, get up from your couch, go brush your teeth. And floss. I know a lot of y'all watching this video do not floss. Point at yourself after watching this, because I know y'all not flossing. But also comment if y'all do floss. I want to give y'all y'all credit. As always, if you have any of these conditions, please seek help, because at the end of the day, you matter. Fictional characters were used to give a different perspective in any situation. If you appreciate this video, please like, comment, and subscribe. If you haven't already, please check out the previous 23 parts to this series. And if you have a suggestion for part 25, please drop it in the comments. And if nothing else, y'all take it easy.